the important telemedical applications. So when you talk about the telesurgery, so the doctor will be connecting in the distance to operate the patients. Okay, so it's we can say as a remote surgery. So the doctor will be given the facility to connect with them the through the medium, so to perform the surgery, okay, on a patient. Okay, so when they are performing this kind of surgery and all those things, so the doctor will be present, will not be physically present near to the patients. Okay, so this is one of the emerging technology, we can say that, in telemedicine. So this is also one of the surgery systems, so emerging surgery systems, we can say. So when you are talking about a lot of surgeries, so the this telesurgery also, it's one of the emerging surgical systems. So when you are looking for the process of telesurgery and other things, so they will be utilizing the some kind of networking process. Okay, so that can be the wireless networking process. So through the medium wireless networking, uh, and robotics technology, so the surgeon will be connected through the medium. So they'll be operating the patients in the distance. Okay, so when you talk about this telesurgery further, so when the surgeons wants to make sure that in the console, so the dedicated console will be there, the surgeon will be sitting on the console, so they'll be connecting through the medium. So whenever the surgery is required, so they will be planning for this or the distance. Okay, so when you're using for the telesurgery, so we have like a high precision robots. So that high precision robots will have the dedicated functions which has the angle of rotation, so whatever the requirements. Okay, so the precise rotations and precise operations can be made possible with the availability of the very sophisticated sensors and actuator systems and others. So when you're looking for the sensors for the sensing purpose, so we'll be using several procedures in the telesearch. So when you're talking about the sensors and actuators, it plays a major role when they want to perform like a telesurgery. So the kind of we can say as a kind of arm, so which is going to be operated on the patient, so that can be controlled by the physician. So you understand. So I'll be showing the block diagram in the later stage. So this small actuators, whatever we are using, so that will give you the very precise the movements and all those things. So that will be very useful. So when the physician wants to have the minor division of cuts and all those things, so that will help you the physicians to take decision in the very precise manner. So when they are taking in the precise manner, so we'll be ensuring that the patient will be in the safety. So the surgery will be in the uh, very accuracy levels and all this. Okay, so the small actuators will help to have the very precise movements and all this. So that is very very important. So when you talk about any searching. Okay, so if the actuators and the sensors will help for the very very important role here to have the precise procedures with the surgery and other things. So this might increase the kind of comfort zone to the patients as well as the physician. That is also very very important, because when you're talking about the comfort zone for the physician as well as the patients. So the physician also will be using this the equipments to perform the surgeries and all this. When I talk about the further, so this actuators, whatever we are using, so that's going to be used for the robot movements. So that's actually it's going to initiate the robot movements. Okay, so whatever the surgeon from the console, they're giving the instructions. So based on the surgeon instructions, so which angle it has to rotate, 30 degree or 60 degree incline, how much its depth in it has to be operated. So everything the instructions will be given by the surgeon. Okay. So for example, we can say as the lot of surgical applications as telesurgery applications we have, like laparoscopies and thoracoscopies surgeries. So these are all very useful applications when you talk about. So when you talk about the robotic telesurgery, so that's already I told you, right? That's going to give a kind of a comfort zone for the surgeon. So they will give you the kind of professional techniques into the OT operation theaters and other things. So that is also giving another comfort zone for the surgeon to sit in the console. Okay, so they will be they're not near to the patients and others. So there is no need to present physically near to the patients. So that is also very very important. So sometimes this may help you in the covering the long distance surgery also. So when you are doing this kind of procedures and other things, we need to ensure about the data exchange information. So a lot of informations will be exchanged in the larger amount. So between the surgeon, so because the surgeon has to give all the instructions to the robot. Okay, so that is also one of the very important thing we need to take. If a small instructions if goes wrong, so it can lead to the some kind of very serious issues. Okay, so during the surgery procedures and all this. Okay, so so whatever the informations they're sharing with the instructions, the robot, the operating machines and all this, it should be very clear. So the lot of informations will be exchanged here. So similarly, when you are going for the this kind of procedures and all those things, so the surgeon also should be given as a very good view. Okay, so uh, so they will be analyzing with the different cameras and other things, so that they can see very clearly. Okay, so uh, with this information, so they can confidently they can using the technology of cameras and other instruments, so they can get the more information on that. So that is also it's very very important. So when you're talking about the cameras, so whatever the cameras I told you, right? So the cameras are instruments. So whenever you are using, so that will be installed in the operation theaters. So when you are using this particular cameras and other things, so we need to ensure that can be operated in the remote locations and other things. So so when you are looking the remote through the remote activities with the camera, so we can control the camera rotations and all this. So whenever it's needed, it can be zoomed, like if you are using like the zooming options, the key operated or some joystick kind of thing. So if when you're using, so that can be operated with the rotations as well as zooming functions and all those things with that. So when you're installing this kind of sophisticated cameras, that will help you to have the viewing options, so as well as the zooming options in the high power level. Okay, so further, so whenever it's needed, it can be captured the video images that will be captured, right? Sometimes the information, all the recorded videos will be the video will be recorded. So that can be taken with the display to the next to the surgeon. so that they can take us a real time without any noticeable delay. That's here is very very important thing is that we need to we need to ensure that the how much the delay will take place. Okay, so uh, whatever the movement they're doing, so the delay will be very costly here. So that is very very important. So the delay should be very very. So when you are looking for them, when they are operating, so that can be taken into the consideration. So this when you're talking about the delay, the small time delay in the robot actions can lead to the irreparable damage. So that's what very important thing. So again, it will lead to the some other very serious issues. So similarly, we need to have the very user-friendly interface for the control for the entire the systems. So we need to ensure the proper training is given with the surgeons. So when they are looking for the this kind of um, the entire system, so we need to ensure that the entire system cooperates well with the surgeons and all those things. So they need to ensure that lot of trainings, demo kind of things can be. So the user interface should have all the sophisticated options, so that will be designed in the careful way. Okay, so that is also still very very important. So when you talk about the further the surgery, we have like a classifications like a open surgery. So in the open surgeries, we have the surgeon and patients. So that directly the surgeon will be physically present near to the patients and all those things. So they will be doing the surgery. So the minimal invasive surgery. So surgeon will be using like a camera as well as the instruments to operate the patient. So to do the procedure and the surgeries and everything. So that time, so they will be using the minimal invasive method procedures and other things. So they will be using the small instruments and other things to open up and do the surgeries and other things. So when they are opening up the tissues and other things, so they will be using some cameras to capture the images and other things. So the minimal invasive. Um, then it's an example we can say as a like a laparoscopy or all this. Okay. So the next level of surgery is the teleoperated robot-assisted minimal invasive surgeries. So here the surgeon will be in the master console. Okay, so we have like a patient bed. Okay, so the patient will be lying on the patient bed. So in between the master console and the patient, so we have like a patient side robot and instruments and camera we have. Okay, so the surgeon will be giving instruction from the console. So they will be having like a kind of a glove kind of thing or arm kind of thing. So from that, so they will be giving the control, so how to operate and all those things. So through that instructions, so your patient side robot will be acting on that. So they will be functioning on that based on the surgeon instructions. So how much angle it has to lead, how much angle it has to cut, so how much distance it has to cut, so how it can be exposed, so how it can be removed and other. So you can imagine like a kind of a robotic arm. Okay, so the robotic arm, how that can be taken. So on the patient head, so that patient will be operated here. So we have like a the generalized system overview. So we have like a surgeon console, patient side cart, as well as an on-site vision camera with the endoscopies and other. So we can add on to this. Okay. So now the surgeon operates from the console, so they will be having the dedicated displays. So all the cameras interface will be connected here. So we are establishing the communications. So through the wireless technology. So or wired technology we can have, because when you're looking for the console, it's connected in the same room. So the patients and the operating table, so they can be connected with the wired technology also. So sometimes so the wireless technology can also play the major role here. The emerging technology, because it's a lot of technology we can use. So we are establishing the communications between the console and the operating table. Okay. So now the surgeon will be seeing through the console. So they will be giving the dedicated instructions to the operating on the patient robot. Okay, so so here we have like a robot systems, so which is a robot arm for the different tools. So they will be actuating for the different angles, so rotations and the different angles. So it will be so the movement can be for the particular area of interest to reach the area of interest. So there's several procedures will be how the surgeon will take place the procedures a similar way, so they can use different tools with them, different dimensions and all those things, so they can use it. So the surgeon from the console, so they can monitoring as well as they can control. So the monitoring can be done through the installed different cameras, and already I told you, right? So that they installed the different cameras to have the functions. So through the cameras, they will be getting all the functions. So zooming as well as capturing of the images and everything. So they can reach, they can get the very good viewing positions. So through the cameras. So when they are giving the viewing positions through the camera, so the it's a kind of comfort zone to the surgeons to operate. Okay, so that is one of the advantage here we have. So when they have the surgeon operating in the particular dimensions and others, and they can extend their view and they can use the zooming options with that. So when you are considering with this, we need to ensure that we need to have the console, we need to have the communications medium, then we need to have the patient card. Okay. So here also there will be the some kind of display units and all those things. So when you are using that display units and all those things, so that can be we can ensure that so the assistant staffs will be operating with that, so viewing on that. Okay. So this is, you need to understand that. So sometimes this telesurgery enables the surgeons to connect with the um, uh, connect to the do the procedures in the several kilometers also they will be connected. Okay, so that is the advantage of this one. So when you are looking for this, you need to have the very good internet connectivity. So the high-speed internet connections. Imagine the connectivity goes off. So that is also we need to mention. So that is very very important. So we have like a classification of the surgical procedures and others. So not all surgical robots are equal. So there are the three different kinds of robotic surgery systems we have. There are commercial availability of surgical systems are available. So here we are getting the classification as a supervisory controlled systems, telesurgical systems, and the shared control systems. So we have like advantages and disadvantages and each and every one. When you look for the supervisory control system, so when the surgeon is performing the surgery, so they need to give the specific set of instructions. So always the surgeon has to provide the input data into the robot. So whatever the input data is fed into the system, so from the surgeon end, so the robot will be working on that. So it's a kind of supervisory and controlled system. So because the input is based on the input only, the robot will be controlled. So when you are the surgeon is giving the kind of instructions and other things. So the surgeon is initiating the motions and all the things to perform the surgery. So they will be having the entire responsibility. Okay. So similarly, the surgeon should have monitor the robot actions and all those things. So whenever they're giving the instructions, so the robot action has to be monitored. So if anything goes away from the plan and other things, so immediately the surgeon has to intermediate or with that, then they need to correct it with that. Otherwise, it will be the very serious conditions. So that is also so. Um, that can be due to a few factors we will discuss in the later stage. Then we have the shared control robotic surgeries. So, um, in the shared control robotic surgeries, those who are involving the humans involvement is most of the work during the surgeries. So this the shared controlled robotic surgery systems. So the surgeons, so those who are involving the surgeons, surgeons for the surgery, so they will be operating all the surgical instruments. So um, so this robotic system have all the facilities to monitor the surgeon will be performing. Okay, so that is going to give them all the information. So the next is telesurgical systems. So we have like already I showed you, right? So we have like a dedicated computer console. So that will be used to perform the surgery procedures. So that is connected in the distance. So they look all the informations from the consoles, then they will be operating. So they will operate at the distance, so away from the patients. There is no need to present physically near to the patients. So that is advantage here. So that will give you a kind of comfort zone to the doctors to sit and not stand near to the patients to perform the surgeries of the person. So here we'll be using the controlling of arms and all those things. So that can be from the consoles. So we have like a kind of a dedicated glove kind of thing. So that can give, that can get all the sensors signals and all those things based on that. So that can be connected. So we have like the dedicated systems for that. Similarly, when you look for the application of this procedures, telesurgeries, we have like several applications starting from the general surgery, cardiothoracic surgery, cardiology, and electrophysiology, and neurosurgery. A lot of surgeries, gastrointestinal surgeries. So the lot of applications we can say that other than this surgery procedures and others, it can give you kind of applications that so you can when they the new surgeon wants training kind of thing, so they can get with the expertise. So from the expertise they will be getting this the training for the new surgeons for this. So that is also it's a very very important applications we can say that. Again, assisting and training surgeons in the developing countries from the uh, developed countries expertise will be delivering to them. So kind of assisting us with the training during the surgeries and everything. So sometimes they can connect with them remotely. They can give their suggestions and everything. So this encourage for the collaborating as well as mentoring during the surgeries by the surgeons in and around the near places as well as the far places also. And the globe we can connect. So if you have that, very good connectivity and others. That is the applications. In surgery, so we can ensure that the surgeons have the enhanced view. So that's due to the usage of cameras and other things. They have the enhanced view. So where they can connect with the all the information. So wherever it's needed, it's easier to attach the nerve endings through the visualizations and other things. Uh, so the surgeons also will have the awareness easily. So when you're looking for the in surgery procedures, so only the few doctors required. So in the operating rooms, operating theaters, and other things, because the remaining all things taken by the several instruments as well as the cameras. So the lighting facilities we have. So we can ensure that the only the few healthcare professionals is more than sufficient to do the entire procedures. And all this. So in turn, we need to look for the hospital uh, purpose also. So for them, if when they are the instruments if they are using, so they require the lesser manpower. So, so the infections. So one of the major things we need to think. So when you are looking for the this kind of surgery procedures, we have the smaller risk of infections. So the anesthesia also, the less anesthesia can be utilized because we'll be looking for the minimal invasive methods. So it's required lesser anesthesia. So this the telesurgery surgery procedures provides an kind of improved access to the surgical care. So when you're looking for the all the information, so that can be taken, so for the collaboration purpose as well as training purpose. Because so whenever you are looking for the assist of camera and other things, so you'll be looking for the entire information, so that can be used for the collaborative purpose as well as training purpose. So that is the insights. So we have like advantages as well as disadvantages. When you talk about the advantages, already I told you the minimal invasive methods. So when you're looking for the minimal invasive methods, so the small scars and other, so the duration of the hospital stay will be lesser. So we have, the patient will be having less pain, lesser blood loss. So the side effects will be the low level. So when you have the minimal invasive methods and others, so the recovery time also is in the faster way. So the patient can return to the day-to-day activities in the quicker in the duration. Similarly, they have some disadvantage also. So if the robotic system goes malfunctions or fails. So, say example, already I told you, right? So when the surgeon is giving the instructions due to some connectivity or due to some delay, if system fails or system doing some kind of malfunction, so then it will be the kind of disadvantage. So we need to address to that. So again, the cost. So will be because robotic surgery surgeons will be very lesser volume will be percentage will be available. So this availability of surgeon we need to use. So for the robotic surgeon is, so again it will be getting appointment with them and fixing with the surgeries and other things that I need to consider this, as well as the investment cost, the capital investment of when you are installing the systems. That is also one of the disadvantages we can see. Okay, so, but we have a lot of advantages with that. So people. So the next is a very important is for the telemedicine purpose. So always we'll be getting as an informed consent form. So it's a kind of a process to have. Several times we discussed with that. So when the patient is going for the OPD or any procedures, treatment procedures or testing purposes, so they will be having the consent forms. Okay. So when you look for the consent forms, so the patient has to the volunteers, if you are doing for some clinical studies and other things, so the volunteers will be involving in that. So they need to provide all the relevant informations. So they need to understand that what information they are provided. So we need to get from them, so whether there's agreeing to the participate for the studies and all this. So when you're doing this kind of studies, you need to get the information, so the basic information about the volunteer or patients. Then they need to understand, so what exactly your study is going to be. So all those things. So these are all the very basic rights you need to do for them. Okay. So when you look for the consent forms, you need to understand the patient has to give the consent. So they have to disclose of all information about them. So when they are disclosing all the information to the form and other things, so they need to understand that what they have to disclose, what what for they're disclosing. So the reason has to be explained to them, so that it will be the basic rights for them to understand. So why I'm disclosing this information to them in the concerned authority level. Similarly, whatever the information the patient informed in the consent forms and other things. So whether it's uh, the information, patient information can be shared with the other healthcare professionals. So that has to be informed with them. Okay, if it is needed, so they will be sharing the information. So one more important thing is they have the rights to withhold that information also. So whenever it's needed. Okay, so whenever the patient is giving all the concern informations about that, so we need to respect them. Um, request by the patients. So all the information, whatever they shared to the consent form as well as the consent authority, that should not be shared, disclosed to the third parties in the case. So some few cases that will be very sensitive information about the patients should not be shared, disclosed to the other third parties in the case. That is also it's very important. So again, sharing of the information with the other healthcare professionals and other things. So only you need to release whatever the informations needed for the particular purpose. So other than that, so the information should not be shared with the even the with the healthcare professionals. That is also so very important. So whatever the information disclosing, so all the informations have to be kept in the confidential way. So that should be taken care of. That is a responsibility of the organizations. Okay, so then they need to keep in the confidential way. So again, all the confidential information. So if they decide to disclose all the confidential information, so you need to ensure and you need to give the explanation and you need to justify why you want to disclose the information. So that is very important. So collecting the consent, so keeping in the confident way, that is very important, that comes into that.